a predisposition. All right. So you inherit a predisposition towards getting a mental illness like a mood disorder, which makes you more vulnerable towards something like suicide. If someone has experienced, for example, past abuse or trauma, adverse childhood experiences, the things that you went through growing up as a child, maybe you were abused physically, you abused sexually, maybe you grew up with absentee caregivers. What really did you experience as a child growing up? Have you been able to process that? Or has it been so internalized in you and you've been suppressing it until it comes to a place where it interferes with your adulthood and you're not able to control it, you're not able to take care of it, and you end up checking into suicide as a way of escape? Bereavement and loss. Some of the people who've died through suicide are people who've experienced a recent loss. And that could be you lose someone that you really loved. It could be through death, it could be through whatever, and you are unable to cope with that loss. Maybe you lost a child, you lost your spouse, you lost a parent, you lost a very good friend, someone who is very significant in your life, and you're unable to cope with that loss. Then if there is exposure to suicide, and sometimes we do have that where we have maybe what we call influencers, especially with the younger generation, who die through suicide, and they kind of role model that, and it becomes something that even the younger people will want to attempt and probably even succeed. Then, if we have what we call modifiable factors, things that can be changed, relationship issues. You may be going through a rough patch in your relationship, but it could be just your personality and your partner's personality does not gel. It could be a relationship issue with your parenting style. It could be a relationship issue with people within the work environment. What can you do about whatever you are experiencing to change that relationship to a place where you're able to live healthy? Physical health, you may wake up healthy today, something happens in the course of the day, and your health is lost, but then at some point you still regain your health. Social circumstances, it could be your sense of belonging, it could be your identity in the society. Things like substance use. Someone who is using substance use does not always have to be to stay in that space where they're using substances, but they can be weaned away from those substances, even if it means, for example, them going into rehabilitation to be able to overcome their addiction. Mood and mental health, because we have resources. If, for example, you're experiencing depressive symptoms, we have mental health professionals, we have psychiatrists, we have psychologists, and we do have psychotropic medication to help with that. Psychological pain, where could it be coming from? You need therapy then to discuss, why do I have so much psychological pain? It could be things like I did mention that we went through in childhood. It could be things that you're holding on to yourself. It could be things like lack of forgiveness. You have a very hard heart, you're not able to forgive people. And when they wrong you, you keep that on yourself. You keep on suppressing and piling it on yourself, and you carry a lot of psychological pain. But if you take that into therapy, then you're able to overcome it. And then access to means that, for example, if we keep firearms, if we keep pesticides, then that can be a modifiable factor. Then we do have anticipated or future factors. Now, sometimes if you have for example, someone that you loved and they died, then on the anniversaries, you could get so emotional, you could get to a place where you again become so sad and you grieve all over again. That could be something that could trigger you to a place where you feel suicidal. And all these other things which are under the future factors, loss, changing circumstances, stressful events, and all that. But there is what we call mitigating strengths and protective factors. How well do you do when it comes to managing your stress? How well do you solve problems? Do you have skills? Do you have social support? I cannot belabor how important it is to have some sort of social capital when you're going through that separation, when you're going through that bereavement, when you're going through that loss. Who is in your social circle? Do you have two, three friends that you can call upon and you know for sure they will come and stand with you through whatever it is that you're going through? Social support is very important, because even in those moments where you have psychological pain, then you can always have that one person that you can call and tell them what you are going through, and you can feel supported. Familial support, Do you have that from the nuclear family? Do you have that from the extended family? In these days where life has become so fast-paced because of the economic situation, we need to create time to touch base with people who matter to us. And family should matter to us, our parents, our siblings, our cousins and grandparents, and all that. Engagement with services, and these are the resources that we have. How often do I make use of mental health services? Even if I am not unwell, we talk about preventive protective factors. What can I do, for example, to keep myself healthy mentally? Can I use the gym? Can I go to the mental health facility just to check on my mental health? Can I do an assessment to check my levels of depression, my levels of anxiety? How well do we engage with the resources? And then also having insight, being able to realize what is going on in my life. People who have insight get better health because, for example, you may have insight that you get angry very fast, that you're a very sensitive person, that I'm a very anxious person. So I have insight as to who I am, and that will help me deal with whatever it is that I need to deal to help me improve my personality. And then if you always have hope, you're always hoping, you're always looking out, you're always seeing the glass as half full, then you have a protective factor when it comes to suicide. So, what are the suicide warning signs? So, someone has been pretty much okay according to you, but suddenly they start talking about being a burden to others. I feel I'm such a burden. I feel if I were to die, then no one really would miss me. I feel trapped in this life. I feel like I have no reason to live. I feel so much pain and no one can take it away. Then suddenly their mood also changes. They were interested in some things, suddenly they have no interest. They become very irritable. They become very isolative. They start, for example, now their behavior using substances. Someone who was not taking alcohol or using weed suddenly starts using. Then they have also a change, for example, in sleep patterns. We say about 7 to 8 hours on a normal would be okay. Sometimes you may sleep 6 hours because you're doing a project or you're doing something that's keeping you awake. And sometimes you may also do 10 hours. Why? Because I went hiking, I was so tired and I slept a lot. So we put this behavior into some sort of criteria for us to diagnose even mental health illnesses, mental illnesses. So if you're having some of these symptoms, it does not necessarily mean that you're looking out to suicide, but this could be warning signs. If you look at these signs, they really mirror the symptoms of clinical depression. Someone withdrawing because depression really loves isolation. Things that they previously enjoyed doing, they no longer enjoy them and they keep away from people. These are changing their appearance. Someone who was very neat, who used to keep their hair well, who used to do a proper haircut, suddenly they couldn't be bothered to look out for how they keep themselves. And sometimes they may also start giving away prized possessions. So someone comes and tells you, by the you can have this laptop and it's really an expensive laptop. They may tell you you can have that title deed to that land and no longer need it. And you're thinking that they're very generous, but really they are thinking about ending their life and they will have no need for these possessions. So this could be suicide warning signs, but remember, we must put them into some sort of context. So how do you help? So this is your partner, this is your child, this is your workmate, this is someone you go to church with, this is someone in your social circle, and you've realized that the things that we are discussing seem to be fitting some person that you know. So how do I help? Number one, ask. Ask them, are you thinking about suicide? Now, this definitely is not an easy question to ask, but what it does is that it helps start a conversation. We have already dispelled that myth that if you ask them, you are helping them to increase suicidal behavior. But we are saying that it helps them open up and they feel that there is a psychologically safe space where they can talk about what it is that they're experiencing. And they feel that someone really is actually interested. They've asked me, am I being suicidal? So I can pour out and talk to them and they feel taken care of. Then be there. Listen without judgment. Put aside all your thoughts about what suicide is, what suicide isn't, about what the Bible says about taking your life, about the ethical versions, the moral versions. Be there and listen without judgment. Acknowledge their pain because their pain is real. And acknowledge that they want to take their life because that is where they are at that moment in time. And remember that we are also saying that most people who die through suicide are experiencing probably a mood disorder, depression, clinical depression. And at that point in time, their cognitive function is also impaired. So they're not in a place to make the correct decisions, the right decisions, because their thought patterns are also already so impaired. So be there, listen without judgment. This is not the time to preach to them and tell them that, suicide is wrong, you will die, and then you'll go to hell. Trying to moralize, that is not what is necessary at that point in time. So be there and listen without judgment. Knowledge what they are saying and let them know that their story is valid. And then number three, help keep them safe. And that is where we're talking about reducing access. If, for example, they have access to some knife you've seen lying around there, or a rope, or a firearm, or a pesticide, or pills, try and reduce access by removing them from that situation or removing those things from their environment. Then help them to connect. We have community resources. You can help them also reach out to someone that they trust. It could be a spiritual advisor, it could be a mental health professional, it could be a clinic, but help them to connect with a resource that will help with their mental health. And that is by asking them, who do you feel comfortable? Who should I call? Can I walk with you? Can I take you to this particular facility? Can we meet a psychologist? Can we talk with a counselor? Can I connect you to someone? And then help them to connect and then follow up. Most of us may end at the point where we help them to connect with a mental health professional. And then because of our own prejudices about suicide, we will tell someone, me, I help them connect, and that was it. I don't want to be part of that story, but you need to be part of that story. And that is why we are talking about suicide. Changing the narrative is about having those open conversations that, yes, I know a person who was who was having suicidal ideations, and I connected them with a mental health professional. I followed up, I stayed in touch with them, and I have been very supportive, and it has played a vital role in prevention of suicide. So ask, be there, help keep them safe, help them connect, and then do a follow up. So, what are the barriers that prevent people from seeking help? If, for example, I feel so depressed, I feel so low, I can't sleep well, my appetite has gone down, or if I'm eating a lot of junk food, I cannot even find myself in a crowd. I want to just be at home, sleep, draw the curtains, no lights. What are the barriers that prevent me from seeking help? Number one is stigma and embarrassment. Already, if you're thinking suicide, the society has already judged you so harshly, and you're considered to be a pariah in society. So that stigma and embarrassment is what prevents people from seeking for help. Again, if you're not able to recognize that suicidal ideations which are repetitive over and over again, and then you have those symptoms that we've mentioned of clinical depression, if you're not able to recognize that those are symptoms of poor mental health, then again, you may not seek the help that you require. There is something that we call preference for self-reliance, and this has a lot to do with the men in our society. Men usually hardly will take themselves to hospital until they get to a place where they really must be dragged to the hospital. And if they're having mental health issues, they're thinking suicide, they are even more disadvantaged because we've cultured our men not to show their feelings, not to talk about what they are feeling. So we have told them that men must not cry, men must not wear their hearts on their sleeves. You must be strong. No matter what you're going through, you must be strong. So what do? They suppress all their pain, they suppress all their struggles, they suppress all their difficulties. And eventually, they may end up taking their lives because they had no way to discuss what they were going through, because they will be considered weak. They'll be told a real man needs to know how to handle himself. So that preference for self-reliance will prevent them from seeking for help. And yet, probably it's not what they want, but it's what society has pushed them to be. And remember, the more you suppress the things that you are experiencing, whether you're male or female, those things also have a way of showing up physiologically in your body. So you start having, for example, colds and flus because your immune system is very suppressed. You become susceptible to infections. You have what we call gastrointestinal issues. you have a lot of aches and pains, you have even chest pains, you may even have skin breakouts because you're going through so much that it is no longer now just psychological, it crosses over and becomes physiological. So men, you need to really talk about what you are experiencing. If it means we create clubs for men, by men, where they can talk, where it can be a safe space for them to talk, then that is one of the avenues that we need to explore. Issues of confidentiality and trust. So I shared my story with this particular person, and the next thing at the work environment, I had everyone discussing my story. So that will prevent me from seeking for help because my experience taught me that there's no confidentiality and trust. And then the feeling of hopelessness, especially if I'm experiencing depressive symptoms. One of them is a feeling of hopelessness, that no one can take care of this issue. There's no one who can help me. There's no one who can sort this out. It's too big a problem. Now, most people that we have talked to who have attempted suicide and survived usually say, if my problem could be taken care of, then I do not see the need to kill myself. So you take the problem away, and the person still wants to live. So within the work environment, how do we help people? How do we support people to seek for help? Number one is by normalizing that conversation. Let people be open to talk about issues of suicide. The same way they talk about going to the gynecologist, going to the dentist, going to the general practitioner or the oncologist. Let us try and normalize that conversation around suicide, and let it also be normal for someone to say, by the way, I have an appointment with my psychologist, with my psychiatrist. Again, let us avoid perpetuating stereotypes about mental illness. What are we doing about the people who have been diagnosed with mental illness and they are in our space? Some of them, it has been struggles with alcohol. And I need to remind you, alcohol is not a social disease. It is actually a brain disease, which has been completely which has been said to be a mental health illness, as in, and is in the catalog for mental health disorders. So let us not categorize alcohol as a social disease and blame the people we are working with who have been to rehabilitation, but let us integrate them back into the community, into the society. Let us not give them funny names like Kalewa, or we call the ones who are going through poor mental health, we call them Mwenda, we call them crazy, we call them psycho. In Kenya, we say Amechizi. So let us avoid perpetuating those stereotypes about mental illnesses. If we keep on using that stigmatizing language, then people, even when they're diagnosed with depression, with bipolar, with schizophrenia, they will not talk about it. Why? Because of the stigma surrounding it. Then again, support and encourage people to develop a care plan. If, for example, someone has a mental breakdown within the work environment, what would you like us to do about it? Now, the government has put in place that, we need a mental health policy within our organizations, depending on our standard operating procedures. So it's good to have a wellness committee within our organizations to come up with mental wellness champions, people who champion the cause of mental health. Because if, for example, someone starts having what we call hallucinations within the work environment, they start seeing things and hearing voices which no one else is seeing or hearing, what do we do with them? And even for us to take care of ourselves, can we always have a plan of, in eventuality, I get into a place where I have a breakdown, who should be contacted? Then within the office spaces, if it is on the walls, if it is on the website, if it is in people's laptops, have resources for information in terms of mental health. Online resources which talk about how to do self-care, which talks about how, for example, to do breathing exercises, things like mindfulness, something that will promote mental health to help people maintain their wellness or their well-being. Even things like healthy eating, things like physical exercises, things like social wellness, social capital, to continually send flyers or e-shots within the organization to remind people about taking care of their mental health and even the importance of mental health. Now, it's also important for people in management to be aware that if, for example, you put a resource to help with people's mental health, because sometimes you use a resource that is away from the organization, then it is important to be aware of things like the cost, the location, the opening hours, the culture of that particular resource, the literacy of your people, and all that, because they can be barriers to help seeking. If, for example, you belong to some religion where you feel you may not be able to talk to a female psychologist, then your organization needs to figure out, does that organization have male psychologists who are multicultural, who can take care of the mental needs of our particular employees? Then work to make your resource offerings as inclusive as possible. It is important to include every religion, every culture. Even when you're giving them resources to support their mental health, think about the different cultures that you have. And then again, when it comes to the managers, the CEOs, the bosses, they need to model health-seeking behavior. If, for example, there is an employee assistance program within the work environment and the bosses are not using it, then ordinarily the people below them may not use it because the big bosses are not using it. Why should I make use of it? So let us quickly mention at the family level, how do we handle the issues of a suicide? Now, we go back to the parenting styles. And parenting styles, by definition, represent consistent patterns of behavior and attitudes that we parents use when interacting with and raising their children. So you need to ask yourself, what is my parenting style? If, for example, I am a parent, what is my parenting style? Now, there are very many parenting styles, but we have four main parenting styles. And maybe we can look at them because how you parent your children also determines the state of their mental health. Now, there's a parenting style which we advise as mental health experts that it be the parenting style that will work for you as parents, and we call it authoritative. It has a high level of warmth. Yes, as a characteristic, it has high control, but what it does is that it encourages independence, it fosters self-discipline and confidence. Now, it can be time consuming because as a parent, you need to be quite patient and consistent. Because with authoritative kind of parenting, we have, for example, what we call democracy. So, for example, the child wants to go out and you tell them by 3 p.m. you need to be back in the house, and they say, no, mom, or no, dad, I would like to be back at 4. So you negotiate, and there's some sort of democracy, and you agree. But the parent is still the authoritative figure, but there is communication, there is negotiation. So how do you know that you could be using this parenting style? Is because you set clear rules, but you also listen to your child's feelings and you encourage independence. And one of the key things about this parenting style is consistency. If we say bedtime is 7:30, then we stick to that. If we say you only use your tablets over the weekend, then we stick to that. But if the child says, Mom, there's something I needed to check on the tablet for about an hour on a Friday or Thursday, then you still have the leeway to allow the child to check. Now, we do have what is called authoritarian kind of parenting. There is very low warmth and there is extremely high control. So the parents, the pros, the good thing about it, yes, it is that it creates structure and discipline, and the children follow the rules well. But now the children follow the rules because it is fear-based. If you do not get to bed by 7:30, there will be consequences to that. It is kind of either my way or the highway. So the child will feel that they are constrained. If I don't do what I need to do, then I will get into trouble. As opposed to the child who has the authoritative parent, they know they can talk to their parents and tell them, I was supposed to be home by 4 p.m., something happened and I was a little bit late. And they know that they can discuss that with the parent. But the authoritarian parenting, you expect strict obedience, you enforce rules without flexibility, and you rarely explain decisions. And those in this category are the ones when the child asks, why should it be that way? They will say, because I am your parent or because I said so. So authoritarian kind of parenting may be pushing your child away. Then we do have what is called permissive parenting. High warmth, low control. Now here you nurture creativity and emotional security, but however, they can be very poor self-regulation and difficulty following rules because either way, the child, whatever they want to do, you kind of allow it. You rarely say no. You avoid discipline and you allow your child to make most decisions. Then now we have the uninvolved or neglectful parent, where the characteristic is low warmth, low control, and the pros is that it encourages independence, even if kind of mild, but now this leads to emotional detachment, there's lack of guidance, there are behavioral issues. And how do you know if you're using this style? Is that you are emotionally distant, you provide minimal supervision, and you are often too busy or disengaged. And then people will be asking, how come the rates of suicide have gone up very high amongst the young population? Parenting comes into it. Of course, there are other things like social media exposure, but how you parent will also dictate or is usually a factor when it comes to the mental health of your child. So it is important to understand your parenting style. And usually we do what we call intergenerational parenting. Family history. How were you parented? Cultural background. There may be some things that are allowed, in the Western setup, but here in the African or in the Kenyan context, for us, they may not be appropriate. Socio-economic factors, things like resources. What do we have? Are we living from hand to mouth? What are our stress levels? What are our living conditions? Because all these will shape how parents interact with their children. If you're chasing some sort of sustenance from dawn to dusk and you never get to see your children, of course, then you become the very uninvolved parent, even though not through choice. Education and knowledge, if the parents are more educated and not necessarily academically, but they could be having some sort of knowledge from wherever, that will also influence the approach. And then the temperament of both the parent and child. You may find your child behaving in some sort of way, and you forget to ask yourself, could this also be my personality? Could it be my temperament? Is this child a little me? Is this child a mini me? Because the temperament of both the parent and the child will dictate then the parenting. So when it comes to things to do with mental health, which may predispose the child towards suicidal ideations, if we got the statistics right, in Kenya, we had the youngest child as young as 9 years old dying through suicide. We've had cases where girls have gone and, taken their lives. Why? Because they were ridiculed because no one took them through their first menstrual cycle. So they probably kind of messed on themselves. People laughed at them. And what did they do? They go and take their lives. So you want to ask yourself, where are we as parents? How well do we know our children? How well are we interacting with our children? If, for example, my child is being bullied in school, how well do I know, or what environment have I created for my child to come and tell me, by the way, mom, I am being bullied, or dad, I am being bullied? Now, these are some of the questions that you need to ask yourselves. Recently, in the news, if you've been following, there's a child who was about 16 years old and they died through suicide. They were being encouraged by a chatbot. So OpenAI was encouraging suicide, and it even helped the child create a plan for how they were going to kill themselves. So we need to ask ourselves as parents, what sites are our children accessing on the internet? How often do we go through the phones or the gadgets that we give our children? And remember, again, it goes back to parenting. If I have the authoritative kind of parenting, it means that I'm at a place where I can be able to talk to my child and talk about issues, about life, talk about things like sex, talk about things like peer pressure, talk about things like substance use and abuse, literally discuss anything with my children. But am I at that parenting, do I have that parenting style that encourages those open communications? So ask yourself, even as you're listening to me, what sites does your child access on the internet? And if you can read that example, it's about a 16-year-old who died through suicide. And if I'm not wrong, the parents are suing that chatbot for encouraging their child to die through suicide. Simple questions. Who is your child's closest friend? Do they even have a close friend? Or they are that child who, for whatever reason, are so isolative in school such that they do not have the social skills to even make friendships. And they become very isolative. And when they become isolative, they start construing up images of no one loves me, no one likes me, I am all alone. And even at home, mom does not even ask me about how my day was. She does not ask me about who my friends are. Again, do we know what our children aspire to be in life? How many of us have asked our children, even those in PP1, PP2, what do you want to be when you grow up? And if you do have that conversation, it is interesting because it keeps on changing from one career to the other, but it is important to ask your child those kind of questions. If someone was asking your child about you, how would they define you as a parent? Is it that man they hear coming in at around 10 every evening and leaving at 5 in the morning? Is it that lady who comes so tired and just says hi and then goes to the bedroom? How would your child or your children define you as a parent? Again, as parents, What informs you when your child is sad or struggling in life? Do you notice behavior change in your child? Do you notice some sort of anxiety? Do you notice when they're sliding back, into some behaviors which they did not have? For example, the child starts bedwetting. Again, when you look at the academics, because that is what most of us focus on, you realize the child has started sliding backwards when it comes to their grades. And that makes us very concerned. But do we look at other behaviors? The child is sleeping much more than usual. They are much more quiet than usual. They no longer want to go for social functions. They're not eating as well. They're kind of keeping to themselves. They're moody, they're irritable, and it is not just a teenage or adolescent issue. So, what informs you when your child is sad or struggling in life? How much time do you spend with your child in a given day? Or maybe I should have asked, how much time do you spend with your child in a given week? Owing to the ups and downs of life in these modern times, how much time do you spend with your child in a given week? So we tell the parents that you need to touch base with your children more. If you're able to be with them in the formative years from around 0 to about 12, the better. But when they hit teenage, from that teen going upwards, then it becomes just a little bit difficult to create a relationship with them. Why? Because at that point is when they're more interested in being with their peers. They prefer to hang out at the malls, hang out within the court or wherever with their peers as opposed to hanging out with their parents. But if you create a very good relationship with them in those formative years, then even when they're at that teenage level, they'll still come back to you because they know that you're their safe space. And they will get the right kind of information, the right kind of values from you, because you're the one who is best placed to give the right values and the right ethics to your child. So, what do we tell you to do at the family level? Tune into your child's world. If, for example, you want to listen to BBC and you're trying to listen on a radio, there's a way that before you get that particular frequency, there's a lot of noise. And you could be having those noises with your child, you're not understanding each other, but slowly by slowly, you tune in to BBC at the right frequency and you're able to listen to a clear channel. So ask yourself, what are all these things that are hindering me from connecting with my child? Remember, go back to how you are parented because that is probably the kind of parenting style that you're using. Yet, you're parenting a different generation. Very many people have come up to us and asked us, what do we do about this generation, Gen Z? What do we do about them? And the ones coming up, the alpha and beta, what do we do about them? And we tell them it's not about them. It's about you as a parent who needs to change your tactics on parenting. So tune in to your child's world. Understand who they are. See them beyond that person who goes to school and they need to check their grades and check their homework and sign their diary. Who really is this young person living in my house? Talk more. Create more time. If possible, try and have dinner time with your children. If not every day, because that may not be possible again because of the fast-paced life, at least try 1 or 2 times in a week to have dinner with your children. Talk more with them. Go out with them. Take a walk. If you're going to the gym, if dad, you're going to have the car repaired, you're going to the garage or you're going to the farm, go along with your sons. Let them learn what it is like to be men from you. Because if they don't learn from you, they will learn the wrong kind of things from the wrong men. Now, if you are a woman and your daughters are there, go with them to the market. Try and involve them as much as you can in your life. And the best conversations happen in those places where there's no structure. We were just going to the garage, we were going to the market, we were baking a cake in the kitchen. That is when you get to know your children better. So create forums where you can take more, you can talk more. Then take turns. As parents, we are given more to listening to our children and waiting for them to finish what they are saying. We are already constructing a response in our minds. So we do not even kind of listen, but we need to take turns to hear them speak. And then you respond. And they speak, and again, you respond. Yesterday, I met a very good group of people, and one father said that his Gen Z children usually call him for a meeting and they tell him everything that they're thinking about. Dad, I'm jobless. Dad, I need one, two, three. And sometimes he does not have the answers. And he tells them, okay, I have heard. Can we now have another meeting and you give me time to think about all what you've told me? So that shows responsible parenting. He's not waiting to just respond or to just give them answers, but he's really wanting to take turns. It's their turn to talk, and then they can also give me a turn to respond. So at the family level, tune in, talk more, take turns to catch up with your children. So in concluding, we have what we call steps to help seeking, because you could be listening to me there and you could be having those suicidal thoughts, and they don't just go simply because you've had someone talking about suicide and prevention and all that. They may linger because of your circumstances, but remember, recognize you are powerless to overcome mental illness or addictions or mental breakdown on your own. So reach out for help. People may not know that you need help unless you reach out and say, I need help. And then find the help that you need by getting a proper diagnosis. Go to the right kind of a professional. Even before you go to a professional, get support from the family, from your church elders, from your pastor, from your imam at the most. Get some help from someone who is in a place to support you. Do not downplay and say, my father, my mother, my significant other, my partner can't help me, but really reach out for help and then get the help that you need by getting a proper diagnosis. Then if you need a treatment plan, then get one specifically tailored for you. Don't say my friend went through depression, this is the treatment plan that's used, I'm going to follow it. The dynamics are different. So see the professional and get a treatment plan specifically tailored to you. If, for example, you realize that a family member or a colleague is struggling, there is change in behavior. And I keep on belaboring the point of depressive illnesses. They become isolative, they feel very hopeless, they feel very helpless. They no longer enjoy things that they previously enjoyed. Their appetite patterns change, their sleep patterns change. Maybe they start indulging in substances. So if you notice that change in behavior, then you encourage them to see some sort of support. This could be through a counselor, it could be through a psychologist. At the work environment, it could be that you have a wellness department or an employee assistance program. Then help them by taking them to the right kind of support. So what happens, for example, when they come to a mental health facility, then we do an assessment. For example, the symptoms I'm talking about of clinical depression, one does not you must have those symptoms for not less than 14 days, not less than 2 weeks continually. So if you come and you have those symptoms maybe for 3, 5 days and you're feeling very suicidal, we will still be inclined to say they are depressive symptoms, but will not conclude that you have clinical depression. But then you do the assessment. And then if you realize that from the assessment, this particular client needs further help, then we push them to the psychiatrist, who is the one licensed to give them medication after further collaboration with the psychologist. If, for example, we determine that this person is very unwell, maybe they had already attempted suicide, we say one of the very high risk factors for someone to die through suicide is a previous suicide attempt. So if they have previously tried to kill themselves, we will even insist that this person needs to be admitted, and we put them on a 24-hour suicide watch. So we admit for further management and care. When they are better through therapy, if they need medication, we give them medication, and then we discharge them. And then after discharge, we still do follow up. So we have some tools which may help you with your mental health. They are not diagnostic. So if you are able to, and I will share the slides to scan this QR code, you will be able to assess yourself for depressive symptoms, for anxiety, for alcohol use disorder, for post-traumatic stress disorder, and I think for one more, for burnout. So this self-screening is not going to tell you that, yes, you are depressed, but it will be an indicator as to the state of your mental health. So it is like what, for example, we have at home. Some of us have the blood pressure machine, and sometimes when you're not feeling so well, you can take your readings. So the readings that you get don't always make you rush to a mental health facility or to a hospital. But you can do the readings again today, tomorrow. If they remain consistently high, then it becomes a cause for concern. So it's the same thing with these mental health self-screening tools. If the readings remain consistently high and the feedback you get is that your depression or your anxiety levels are very high, then you can reach out to a mental health professional. And with that, my last comment will be that suicide is a permanent solution to a temporary problem. And I did say that most people who are suicide survivors will tell us that really I did not want to die. If the problem or the issue could be solved, then I would still want to live my life. And with that, I would like to hand it back to Steve for any clarification, and then we can call it a session. Over to you, Steve.
Thank you so much. Thank you for such an inspiring session. At this point, I would just want to open it up for Q&A. So if you have a question, you can unmute, or you can raise up your hand so that I give you a chance. You make it brief and straight to the point. I'm looking at to see any hand raised. Any question, any reflections, you can raise up your hand so that I give you an opportunity to ask the question. I'm checking out the chat box. Oh, there's a question there from Phoebe. Is suicide hereditary? Is suicide hereditary? And then there is also another comment there from Samuel. You've mentioned adversely about employees' wellness at workplaces. From my experience, the majority of depressive illnesses are work-related or toxic managers. Kindly speak on this. So maybe you can pick on the two as we wait for any other questions that would come up after that.
Thank you, Steve. When it comes to the majority of depressive illnesses are work-related or toxic managers, I guess if the environment is toxic already, probably the people working there are toxic in one way or the other. But I don't know if I really want to give my 2 cents on that. But generally speaking, many depressive illnesses, yes, will come from the work environment, but they could also be from the home environment. So you cannot be healthy at home and then you are uh, healthy. You are unhealthy at work. So if you have depressive symptoms at home, you will still most likely have depressive symptoms even within the work environment. Now, why would you be having depressive illnesses? Maybe, yes, you do have a toxic manager. Maybe you have a job description which is not clear or job role which is not clear. You are probably invited to work in that organization and told this is your job description, and then later on you're given a role for which you had not applied, because that happens in some companies, some organizations. So it could be, yes, that it's the work, the workload. Maybe there is no timeline for you to finish on certain projects. Maybe there's favoritism. Maybe there's harassment within the work environment. Maybe you're looped out of projects when projects are happening because you're not close to the toxic managers. It could be all these things happening, but that is why we then talk about your need for self-awareness, that you need to know that I am getting depressed because of this work environment. What can I do about it? And we say that there's what you can do about it, and sometimes you can also decide that I can no longer work in this organization if your mental health is compromised. Because at the end of the day, if you are unwell mentally, then you'll not be able to continue working. So if you realize that your work environment is the reason why you're depressed, then do what you can about what is doable. What do I mean by that? If, for example, you have a toxic manager, then you need to approach that manager and discuss what you consider to be toxicity, because it could be his personality and you may be judging this person wrong. But again, if it is very overt and you know for sure it is toxicity, then you can involve a third party, maybe, for example, his superior or maybe the HR manager, and then see if this can be sorted. If, for example, it is you do not take leave you do not have time to take leave, then you need to apply that and take your leave and go rest. If there's no work-life integration, for example, you need to draw boundaries. You need to tell yourself, yes, there's work, but the other aspects of my life, it's not work-life balance, it's work-life integration. So I need to draw boundaries even at the work environment. So if it is that toxicity, if it is too much workload, then you need to do what you can about what you are able to do. And then if all else fails, then you need to choose between your mental health and where you're working. You may probably try get something else out of the organization, or you may pursue a different career path altogether. That may not be very exhaustive in answering, but I see there's also the question, is suicide hereditary? And I think I did mention at the beginning that we do not really want to say that suicide is hereditary. It's more about you being predisposed to genetic component of mood disorders. So what you're likely to have is, for example, you have a parent who had a mood disorder, then you as an offspring of that parent become predisposed to becoming depressed because of the genetical component. So not really saying that suicide is hereditary, but it does run in families. But when you say it runs in families, then we'll be referring more to the mood disorders that run in the family. Back to Steve.
Thank you so much, Dr. for that. Any other person with any question as we come to a close? There is a question there that, are the slides shareable?
Yes, Steve, we will share the slides.
Okay. So then that means that if anyone would want to get the slides, because we didn't register anywhere, if you are already in the Candid Hope groups, we will share the slides there. But if you are not, then I request that kindly you do an SMS or a WhatsApp to the number I'm typing on the chat so that you're able to get the slides. I would prefer a WhatsApp so that I just forward you the slides when I receive them. So the number is 0781 1769 32. 0781 1769 32. It's there on the chat box. If you want to be receiving communication on such webinars and you want to receive the presentation. Thank you. I'm opening it up for one more question as we finish. Is there anyone with a question? Elsie says, thank you, Rika, for such an amazing presentation. My name is Elsie Kanu, a BA Counseling Psychology student at Daystar University. I'm interested in doing my practicum at Chiromo Hospital Group. Could you kindly help me in applying for it?
I think, Steve, you can share my number.
Okay. I just text it here, right? Or I'll share with her. Okay.
Yes, you can share with her, yes.
So Elsie, please kindly take note of my number that I've shared there, so that you share your number, so that I'll give you the speaker's number. Again, I've shared my number there. If you want to receive the presentation and any other queries, please feel free to reach out. Then we'll do what's appropriate. If there's no other question, thank you so much. Or I saw Locho, do you have a question? Your mic is unmuted. Okay. Ephantas, do you have a question? I see your mic is unmuted.
Yes, I wanted you to share your number again. I have not taken it.
Okay, I'm sharing it again in the chat box so that you can see it. So if there's no question, I am not sure whether Jedida is around. She was kicked out. Jedida, are you around? No, Jedida was kicked out. All right. Now, to our speaker, we are grateful. And the chairman for Kenya Christian Professionals Forum is Senior Counsel Charles Kanjama. On his behalf, we are grateful for such a webinar. Again, as we said, at Kenya Christian Professionals Forum, one of our key committees is Life Committee, where we advocate for protection of life. And suicide is one of the things that we continue to engage such a conversation, and especially in universities and colleges, and even in workplaces where we see a lot of suicide cases happening. So this is a timely conversation, and we are very grateful. I would, at this point, invite you back, our speaker, to give us your parting shot, and then I will ask one of us to pray for us.
Thank you, Steve. I see someone was saying that we disappeared. I didn't know at what point they probably lost us, just as a point of concern, but we will be able to share the slides, Steve, and you can be able to share with them. And I would like to speak to the audience again that there's always hope. We do have resources and we must change this narrative. Already, we've succeeded in having the whole story of suicide being decriminalized, and we are working at having the National Assembly repeal Section 226 of the Penal Code. So there's always hope. Please reach out. Let us change this narrative. Let us have these open conversations. Thank you, Steve.
And again, just before we close, I normally see after such webinars, organizations or churches or individuals reach out to me to invite a speaker or to consider talking to a speaker so that they can do a particular session. Maybe you can let us know if you're open for such invitations, if your schedule allows, so that we can continue this conversation on suicide.
Thank you, Steve. Yes, we are open for continuous conversations. We do a lot of that at CSR at Chiromo. We have a lot of resources. So anyone needing that kind of support, continuous conversations, just reach out to Steve and he'll be able to let us know how to touch base with you. Thank you, Steve.
Okay. Thank you so much. Allow me invite the one who just spoke, Ephantus, to do for us a final prayer, even as we close. And then, just for our information, every month we have such webinars. So if you come to our community through that number, you'll be able to get updates on what's coming up so that we continue this conversation. Ephantus, are you able to unmute and just do a final prayer for us?
Okay, maybe before I do a final prayer,
Yes, sir.
can you tell us the recording?
Yes, I also need to let us know that for some reason, our YouTube channel that was live went down. And so we have been going live on Facebook, but we have also recorded this session. So if you share with us your number, we are also able to share with you the recording where we started it. Thank you. That's doable.
Okay, so let's pray. We come to you, dear Lord our God, praising you because of this webinar, and praising you because of the knowledge and skills that we have attained from this webinar. We are also thanking you for the Kenya Christian Professionals Association because of their commitment into improving our mental health welfare, dear Lord our God. They have done this for free, dear Lord our God. We are praying that may you help them, may you help the organization grow, and may you sustain them so that they may be bringing us more and more of the webinars, dear Lord our God. We are also praying, dear Lord our God, that suicide can only be prevented. We can do everything possible, but through you, dear Lord our God, we shall be able to prevent suicide, dear Lord our God. So we are therefore praying that you may come into our lives, may you meet unto our challenges, so that these instances of suicide may be cast out for once and for all. In Jesus' name do we pray, believing and trusting. Amen.
Amen. Thank you so much, sir. Thank you so much, everyone, for attending the webinar. I wish you a good evening. Bye, everyone.
Bye. Bye. Thank you very much, everybody.
Bye.
That
Bye.
was I've enjoyed it. I'm listening, watching from US, Georgia.
Thank you and goodbye.
Thank you and goodbye. If you want to reach out to us, I'm resharing the number.
Yes, thank you. Thank you.
The number is there. So just do a WhatsApp preferably. Then we are able to continue the conversation.
Okay, the number is 011 what?
Yes, 0781
81
176
176
932.
932. And that name is your name as well?
Oh, the name that appears there is Steve Aomo. I've texted it there. Steve Aomo.
Okay, I got it. Thank you very much, sir. I shall be contacting you by WhatsApp. Thank you. God bless.
God bless you. Bye.